Hello, my name is Dolores Tata. Can you guys hear me?
Wait, no, they don't.
Hello, my name is Dolores Tejada. I have multiple mental health disabilities, often called psychiatric disabilities. I'm a community organizer from Hayward, California at an independent living center that serves Southern and Eastern Alameda County, which is part of the districts of Assemblymember Bonta and Assemblymember Baker. As someone who proudly identifies as having a disability, I have a lived experience as a queer woman of color navigating the medical industrial complex. People living with disability and serious illness have a history of being medicalized, meaning it is seen simply as a medical condition rather than another aspect of the human experience. Medicalizing disability and serious or terminal illness results in people thinking we would be better off dead. When patients only see their general doctors or doctors that they may not have a long history with, as is allowed in AB 2X15, they may not understand these influences. There's only so much a doctor can advise their patients on other, if any, options that are available, because no one is actually required to provide other options, but only to say them. Combine those factors with the lack of access and affordability for many people living with disability and terminal illness, AB 2X15 is not safe or adequate. I am not alone when it comes to being at the intersection of being a person of color and living with mental health disabilities. SAMHSA, the Federal Substance Abuse and Mental Health Services Association, reports that communities of color tend to experience greater burdens of mental and substance use disorders, often due to poor access to care, inappropriate care, and higher social, environmental, and economic risk factors. You may think that with mental health disabilities, I would not be eligible for assisted suicide anyways, but there's a lot of evidence to the contrary. Studies of Oregon and documented examples like that of Michael Freeland, a man with a 43-year history of acute depression and suicide attempts, who still received lethal drugs in Oregon, show that those of us living with mental health disabilities are not protected from the danger by the Oregon model. We are especially at risk if this bill passes because many people in the disability community have been misdiagnosed as terminal. When we begin to place a monetary value on the lives that are socially and medically deemed less valuable, be it because of race, disability, social economic status, sexual orientation, or a combination of these things, physician-assisted suicide will support this injustice. According to a study by the Kaiser Family Foundation, people of color are less likely to be insured because of low income and lack of access to employer-sponsored health care. Over a half of Hispanic people are uninsured, and 2/3 of African American people are uninsured. And while bill sponsors like to point to Oregon as the model, the Hispanic, African American, and immigrant populations of California are significantly higher than those of Oregon. In the community, we know that not only are people of color less likely to be insured, but also have less access to quality health care that can provide them community-based alternative options and positive messages. Assisted suicide adds one more system for POC to have to navigate just to survive. The American Psychological Association's resolution on assisted suicide had this to say: autonomy is an important guiding principle in the law and in psychological and medical aspects of decision making, but in and of itself is insufficient to capture the full range of complex medical, familial, social, financial, psychological, cultural, spiritual, and legal issues involved in the practice of assisted suicide. I am not confident that an insurance company has the capacity to have the best interest of potentially vulnerable communities at heart. Are you? From deciding which medications to provide or what forms of alternative treatments they will help pay for, I know insurance companies could easily, and maybe without even realizing it, promote the devaluing of lives of my community through assisted suicide. Because the monetary value placed on our lives is perceived as a cheaper option, our healthcare system cannot administer assisted suicide fairly. Funding to programs that support people with disabilities like IHSS and developmental disability programs are the exact options that we as people with disabilities need. Legislators should be funding independent programs that support people with disabilities because they fight back against the stigma and stereotypes that negatively affect us. This bill would be a huge step backward in achieving justice and equality for me and my communities. Please vote no on AB X 215. Thank you. I also want to add and mention that in the audience today we have the daughter of Deacon Sal Alvarez, and she is from the from the district of Assemblymember Campos, and she is the executive director of the Salvador E. Alvarez Institute for Nonviolence, and she is present to join in opposition of this legislation, just as her late dad had been and would be if he were still here. Thank you.
It's a little hard for me to get close to the microphone. Is that okay? Sound? Okay. That's fine. All right. Good afternoon. I'm Marilyn Golden, Senior Policy Analyst with the Disability Rights, Education, and Defense Fund. The proponents of this bill present it under the banner of choice. We in opposition present our concerns under the banner of social justice, disability justice, racial justice, economic justice. Choice is a myth in the context of our unjust healthcare reality. End-of-life treatment options are already limited for millions of people, constrained by poverty, disability discrimination, or other obstacles. Adding this so-called choice into our dysfunctional healthcare system will push people into cheaper, lethal options. There is no assurance that everyone will be able to choose treatment over suicide. No material assistance for families of limited means who are struggling to care for loved ones. No meaningful protection from abusive family members or caregivers. This bill protects doctors and hospitals, not patients. It presumes that all families are happy, that everyone is financially secure, and has no one around them working against their interests. This bill assumes a fantasy world where government will effectively address abuse under a bill with no provision for that, based on a model that doesn't show abuse because it has no means to capture it. Don't be seduced by the rhetoric of choice for a few into a dangerous policy change that will bring social injustice to many. Okay, some particulars. This bill is a recipe for elder abuse and disability abuse because an heir, someone who stands to inherit from the ill person, or an abusive caregiver can steer someone towards it, witness their request, legally witness their request, pick up the lethal dose for them, and even in the end administer the drug because no objective witness is required at the death. So who would know what happened? The Oregon model, which this bill copies, is rife with problems. We have evidence which was submitted to the committee that under the Oregon model, in Oregon and in Washington state, under virtually identical legislation to this bill, that doctor shopping has gotten around every safeguard, that people with acute depression got access to lethal drugs, that people have lost their lives due solely or partially to economic pressure and even at times criminal abuse, that deaths have occurred by means other than the patient ingesting the deadly drugs themselves with no legal consequences, notwithstanding what's required by the law. Medical complications from lethal drugs used have added to any miseries already present for terminally ill patients, and that doctors have urged lethal drugs on sick patients who did not ask for them. And it's not difficult to show under the Oregon model mimicked by this bill that misdiagnosis and incorrect prognosis, common in medicine, can end lives prematurely, that people with limited means can use the law to die quicker in order to save their families money. We ask, is that why its supporters would vote for it? Because nothing can prevent that outcome. Also, that negligent medical personnel are explicitly free of any liability for their negligent actions. And that abuse is not investigated. There isn't even a way to report it. Thus, it's not what the Oregon data shows, it's what it fails to show. The data shows no abuse because the system is set up not to find it. This is why 12 states so far this year have rejected the same bill, including New Hampshire, Colorado, Connecticut, Maryland, and Maine, and why overall 29 states over time have similarly said no. In closing, this bill is bad medicine for California. In the name of social justice, please defeat it. Thank you.
Thank you. That was within 7 seconds of the other side. Well done. Well done. So next we will turn and see if the committee has any questions. Ms. Campos.
Thank you. First of all, I want to thank my colleagues that spoke earlier and asked a lot of the technical questions, and also acknowledge Assemblymember Garcia for his question around how faith plays in this decision. We all know that we come here and we try to look at statistics and surveys and policy that is given to us to make a decision, but somehow you always have your personal views that come into a decision. And those who are given a life-ending diagnosis are faced with difficult decisions and a lot of emotions. And I think that in this room and as we have dialogue, we're seeing that through witnesses that have presented today. I have a few questions for the author, and I didn't think about asking these earlier, but after listening to some of the testimony, it is important to be able to understand the process that when a patient gets a diagnosis, they're diagnosed with a terminal illness by the first physician. And I think it was mentioned that hopefully you have a relationship with that physician. Then they have to go seek a second physician. How is that determined? Is it the first physician refers them? Is there a list? How do they go about getting an unbiased second opinion that is not connected to the first physician?
In trying to provide every protection available, we have also tried not to be overly prescriptive. You can, because any prescription that we would do, like you must see somebody in that practice or you must see somebody outside of that practice, can also be seen as, oh, well, you've got a relationship with that physician. So they have to have two. We don't prescribe how that happens. It could be in another system. It could be somebody that the other physician refers, but they must be two separate licensed physicians to provide the diagnosis and prognosis.
And does the bill address if the second physician has a different opinion from the first physician? So if the second one,
if it is found not to be conclusive, then they would not be able to obtain the prescription.
Thank you for clarifying that.
Thank you. Any other questions at this time from the committee? Ms. Bonilla.
I just wanted to give the author opportunity to respond to some of the questions that were raised by the panel around the issues of adults with cognitive impairment, mental disabilities in particular, and then the issue of someone feeling perhaps they would be saving money for their family, and I could see that being a factor.
Mm-hmm. So I'll say, for just the benefit of those that know, I'm a licensed clinician, right? I have a license by the state of California to be able to treat anybody up on that dais or down here who might have a mental condition. We have, purposely, somebody with a mental illness who does not have the capacity to make their own medical decisions may not use this. I've had a lot of talk with people with family who have died from Alzheimer's, who say, why can't Alzheimer's be in it? Have you seen a death of Alzheimer's? And I have, and it's not pretty. People generally starve to death at the very end. But because we wanted to make every safeguard involved in this, it would be too hard to determine at what point somebody was able to say, I want the prescription, and then probably not be able to take it at that time. So if you have a history of a mental illness and you do not have capacity to make your own decisions, you would be ineligible for this. I mean, I don't know how else to say that. We have protected for everything. A lot of the issues the opponents have raised are just not. I mean, this bill does not address that. Is there inequities in the healthcare system? Yes. This bill does nothing about that, though. I mean, we're all still invested in being able to continue forward to be able to provide healthcare in a much better way for everybody. But this bill doesn't go into this. People with disabilities are not eligible for this. Again, people with mental health issues are not eligible for this. People simply because they are old are not eligible for this. It is a very tight criteria of who is eligible to be able to participate in this and who is not. And I would just offer you that I think the data, and when people try to debunk the data in Oregon, it is pretty conclusive. It is pretty conclusive. There's been a lot of research reports done on that. Anybody can go, as you'll be able to do here, go into the Department of Public Health in the state of Oregon and look at the data and be able to see who took it, when they took it, why they took it. And the issue, again, there was some people who wanted us to take amendments that said you only have to be in, your pain be so excruciating that you can't take it another minute and it shouldn't be for financial issues or whatever else. I think we must not lose sight of mind that we are talking about people with terminal diagnoses, people who are going to be dying. And for the most part, when someone gets that diagnosis, they'll get a second opinion. They will have tried multiple things. People will go to Mexico to try coffee diets. People try years oftentimes, as you've heard from people, as everybody who's come to testify who has a terminal illness or who lost somebody, people fought for a long time before they finally said, okay, I'm not going to make it. And for this next couple weeks or month, I want to be able to have my options. And for me, and I come from I cared for both my parents as they died, and people who worked their entire life to be able to provide a little bit for their kids afterwards. I mean, to tell them that last week, go back into the hospital and spend another $20,000. That's, I mean, if that is the thing that people at their very end say, I want to be able to leave a little bit for my family. I don't know how we look at that great generation, because those are the people we're talking about, that great generation who sacrificed and saved so they could leave a little something, how we say, no, you suffer another week and a half because that's the right way. And I just want to speak to Mr. Garcia also. I mean, I am also a practicing Catholic. I spent an hour and a half with my bishop and some of the priests talking about this issue very deeply, because I believe in relationship and dialogue and really being able to hear people out. And the takeaway is that there is pain and beauty and meaning making and suffering. And that may very well be. And some people can choose that, but other people may want another choice. And that's really what this is about, is just providing one more option for those people who have the courage to be facing the end of their life and want one last say, not only in how they live, but in how they die.
Through the chair, just a point of clarification. So anyone with cognitive impairment, this bill would not apply to them. They would not be able to access this. And then you mentioned also physical disabilities.
It must be a terminal diagnosis that there is 6 months or less to live. Okay. Which is the same criteria of hospice.
Thank you. Thank you very much.
Any other questions or questions at this time? Mr. Thurman?
Thank you, Mr. Chair. To the author, Assembly Member Dr. Eggman, and thank you for your offer for counseling. We'll talk about that later.
I've got a special legislator's rate.
Say again?
I've got a special legislator's rate.
Oh, it wasn't for me. First and foremost, I also want to offer my thanks to everyone who's testified today, especially for those individuals who testified for family members who they've lost or for themselves. I want to thank you for your courage, for sharing very private moments and very difficult moments with us to help us try and shape what's a very difficult conversation with some context that I think, as many of you said, you can't fully appreciate unless you've been through it. So I want to thank you for your testimony. Dr. Eggman, my question is simply a continuation of the line of thought that a couple of my colleagues have raised about the fear and the conversation that many have said that individuals with disabilities could be manipulated into a choice here. And I wanted to ask specifically not about cognitive impairment, but about a person who may have a developmental disability or an intellectual disability and has received a diagnosis of a terminal illness. Would that individual be eligible for these provisions?
They would not.
Appreciate the clarity because, as you and I both know in our work and many others who've worked with individuals with developmental disabilities, sometimes, in spite of all of their great efforts, they require some support and assistance in making choices around health and other matters. And I was sensitive to the concerns raised that someone with a developmental disability could potentially be manipulated or confused or not clear, or however the circumstances might be, find themselves making a decision they might not fully understand. So as I understand it from you, if you have an intellectual disability, you have autism, you have mental retardation, and you typically need help making decisions for yourself, that even if you have a diagnosis of a terminal illness, you would not be eligible for the provisions in this bill.
That's correct.
Thank you very much.
Any other questions from the committee? Seeing none, we will now turn to testimony from the public. We're going to start with those in support. We would ask for those who are in wheelchairs or need assistance, they are going to be allowed to proceed to the microphones first for both the support and the opposition, although we are starting with the support. I will give a reminder of the rules of the committee. You are to give your name, your organization or city that you're from, and your position either in support or in opposition only. Ms. Flynn will be monitoring the microphone for us. And so now we'll proceed with those who are in support.
Hi there, I'm Charmaine Manansala. I'm a person with disabilities, Catholic, and a person of color. I strongly support ABX 215.
My name is Ellen Small. I come from Oakland and St. Paul's Tower. I am here to ask you please to support end-of-life options. I'm a retired nurse, and I've seen too much suffering.
Thank you. Let me, before we proceed, let me remind people on both the support and opposition side. Name, city, and position, please. Proceed.
My name is Bill Piper. I'm from Sacramento, California, and in memory of my late wife, please support this bill.
My name is John Lynch. I live in Half Moon Bay, San Mateo County coastside. In 4 months of this year, I gathered 4,322 signatures in support of death with.
Let me reiterate.
My name is Robin Curley.
Hold on, ma'am. Just for 1 second. Just let me reiterate the words, the rules again for both sides. We've got to be fair to both sides. We got it down to 16 minutes and 6 seconds. We had it down to the seconds. Your name, your city, and your position. I assume everybody here on both sides of the issue would like us to vote on this today. So, name, city, position. You may proceed.
Robin Curley, Tiburon. I support the passage of ABX 215.
I'm Kathy Strickland. I'm from Sacramento, and I ask your support of this bill. Thank you.
Hi, my name is Dr. Sarah Pender. My position is hospice bereavement coordinator for 41 years, Roman Catholic, and I'm representing Catherine Teresa McCaffrey, who lived 45 years in that wheelchair and died alone. I support.
My My name's Elizabeth Wallner, and I'm a colon cancer patient, stage 4 colon cancer patient, and I don't want to commit suicide, but
Folks, my vice chair has reminded you of the ground rules and reminded you again, and so I'll take the opportunity to do so as well. We need to move this in the efficient way that we have planned, that we talked about from the beginning when we set forth the rules. So please state just your name, your title or your city, and your position. I know you all have important stories to tell, and if you want to submit those in writing, we will receive those. But at this time, those are the only 3 things to share in public comment. Thank you.
I'm Harlan Seymour. My late wife was Jennifer Glass. I'm from San Mateo, California. I support ABX 215.
My name is Dolores Eitel. I've been a nurse for 55 years. My name is Dolores Eitel. Never been told that I don't speak loud. And I firmly beg you to pass this bill.
My name is Mavis Prawl. My sister Jennifer Glass lived in San Mateo. Please support this bill.
I'm Susie Cohen from Sacramento. I'm asking you also to please support this bill.
I'm Laura Ulster-Martin from Half Moon Bay. I'm a hospice volunteer. Please support this bill.
Lenny Matthews, Lake County Area on Aging Advisory Board. Please support the bill.
Diane Otterby, Menlo Park, California. Please support the bill.
Whitney Gravel, Burlingame. Please support this bill.
Mary Harris from Sacramento County. Please support this bill. Thank you.
Kate Rosenlieb from Sacramento. Please support this bill. Thank you.
Thank you.
J.C. Rowe, Richmond, Tony Thurman's district. Please support the bill, sir. Thank you.
Thank you.
Francesca Ritano, Secular Coalition for California. The coalition supports this bill. Thank you.
Thank you.
Patricia Portillo from Long Beach. Por favor, apoyen esta propuesta. Please support this bill.
Thank you.
Dale Godfrey, Santa Rosa, California. Please support this bill.
Thank you, sir.
Joni Billings, Sacramento. Please support this bill.
Thank you.
Mary Strauss, Oakland. Please support end-of-life options.
Thank you.
Mary O'Brien, Sacramento. Please support this bill.
Brian Lux, El Dorado County. Thank you for supporting the bill. Thanks.
Linda Heights, Sacramento. Please support this bill.
Thank you.
Anita Freeman from Long Beach, California. Please support this bill. Please.
Thank you.
I'm Judith Glass. Jennifer was my stepdaughter. I'm from Alameda, California, and I beg your support for this bill.
Thank you.
Rita Garcia, Pop Inc., Union City, California. Please support this bill.
Thank you.
Dexter Barker, Union City. Please support the bill.
Thank you, sir.
Mimi Carroll, Petaluma, California. Please support the bill.
Ingrid Lindholm, Sacramento, retired nurse. Please support the bill.